Hello, welcome to Dr. Akin Clicks, and I am Dr. Akin. Today I am going to talk to you regarding systemic lupus erythematosis known as SLE. Let us know what is SLE. SLE is a systemic autoimmune disease in which the body's immune system attacks the healthy cells of one's own body. What causes it? The cause is unknown, but circulating immune complexes is a classical feature of SLE. Broadly, autoimmune response in a susceptible genetic makeup of an individual causes it. Now, what happens in SLE? It is one of the autoimmune multi-system disease in which the immune system is unable to differentiate between non-self, example an organism, and self, one's own system. The major systems involved are central nervous system, kidneys, blood vessels, heart, eyes, skin, joints, and others. Now the question is it curable? Is SLE curable? Answer is SLE is an incurable disease, just like diabetes and hypertension. But with the recent availability of good treatment modality, SLE has a very bright outlook as in diabetes and hypertension. With current treatment options, patients may feel as if cured, but only with medications. Cure means normality without any medication, and that does not happen in SLE. So if you have any such belief, please remove that from your mind. This misconcept often makes patients stop treatment and get to life-threatening emergency. Now, what are the available treatment options and its duration? Majority are treated with high initial dose steroids. Patients who are on steroids need not get frightened, as the actions and side effects are known to the physicians. Hence, they can be monitored. The initial dosage of steroid is as high as 1 mg per kg per day, which is tapered slowly after about 2 months and later to a very low dose of maintenance of remission. Now you have to remember the caution. The caution is premature tapering of steroids is dangerous, which may cause flare-up of the disease, and ultimately the patient will end up getting more cumulative dose of steroids. So seek a trained rheumatologist. There are other second-line immunosuppressants like mycophenolates, cyclophosphamide, and azathioprine, which help taper steroids. You have to remember that steroids are also produced in our normal body also. Therefore, inappropriate use of steroid causes more harm. Now, the question is, are there any side effects of steroids, or is there any side effect of steroids? If so, what are the common side effects expected of steroids? Yes, there are side effects of steroid. Common side effects are skin changes. You will see like stretch marks. You will have opacity of lens. Your vision problem will develop. You may have increased blood sugar levels. There will be low immunity leading to infections. The bone will become thin and there is more risk of fracture. Then now we need to know what are the other drugs given for SLE. Along with steroids, chloroquine or hydroxychloroquine are given effect, which has a mild steroid sparing effect. These drugs prevent nervous system and renal disease relapse. They prevent thrombosis, basically clotting of blood and infection, and has very good survival advantage. There are 6 types of renal involvement and treatment. Now let us know the answer regarding the next question. The question is there a role for diet restriction? The answer is no diet can cause nor any diet can cure SLE. But fish can be taken frequently as it contains omega-3 fatty acids, which has an anti-inflammatory effect, and it can also prevent cardiac complications. Restrict saturated fat and high carbohydrate diet, including sweets. Most Indian spices are beneficial, especially curcumin present in turmeric. Spicy food is good in all autoimmune diseases. Now, you may want to know, is SLE hereditary? Most systemic autoimmune diseases have multifactorial etiology or multifactorial causes, and there is a likelihood of the offsprings getting SLE or another connective tissue disorders. But it doesn't follow any inheritance pattern and often not predictable. Yes, genes do play a role. Now regarding pregnancy, what are the concerns regarding pregnancy in a SLE patient? Pregnancy may flare up the disease, leading to a higher risk of miscarriages due to the presence of anti-phospholipids antibodies or fetal heart block, Rho or La antibodies. Pregnancy in SLE needs special care as there is risk to the life of both mother and fetus if not monitored well. Now the next question is there any preventive drug for a SLE patient who becomes pregnant? The answer is no clear evidence in that. Directing close monitoring with rheumatologist or immunologist and obstetrician is the best option. Blood thinners are also used under supervision in specific circumstances. Keep watching this channel. I will be bringing you many more for your information or for your knowledge health related topics in this channel. If you are watching for the first time, please like and press the subscribe button so that you will get regular latest updates on health and health related issues. Thank you very much. See you again in the next video.